A significant number of highly skilled medical professionals from Nigeria are heading overseas. They are mainly relocating in search of better working conditions abroad. But the World Health Organization has warned their exit poses a serious challenge to the health sectors in their home countries. A typical environment where you see various body of health workers making efforts to give better healthcare facility to patients. The immigration of medical and health workers from Nigeria has been on the increase in recent years, with no obvious efforts to manage or mitigate the negative impact of this growing trend on the already weak health system. This mass exodus is undoubtedly damaging and causing a serious obstacle in the health sector of Nigeria, at least in preventing the health sector from achieving more health for more people. At present, Nigeria has a doctor-to-population ratio of about 1 to 4,000, which falls short of the WHO recommended doctor-to-population ratio of 1 to 600 patients. It is an understatement to say that there is a deficit of doctors in this country to serve the over 200 million population. Brain drain in the health sector is a national phenomenon that has not excluded Ondo State. Here at the University of Medical Sciences Teaching Hospital, Akure, Mr. Vincent Oni had escorted his aged mother to the hospital. Mr. Oni, who spoke off camera, lamented how he has waited several hours for his aged mother to be attended to. Mr. Oni, who was obviously exhausted after hours of wait, said the situation is not palatable.
I brought a patient to this hospital since around, it's past 11 now. We have been here since around 9. So we are here to see somebody that will attend to us. Anyway, we are on queue already, but we are here we don't even know where we eventually see the doctor. So that's the issue, and that's how it has always been. This is not my first time of bringing somebody to this hospital. It's a very critical situation. Government should do something about this kind of issue. It's unfair. Coming to hospital and spending hours just to see doctor. It's not the best. But I don't know how many are there in numbers. Maybe they are not matched with comparing the number of patients that's on grant. They are not matched, because if they are matched, all this delay, that's part of it that will reduce the delay. If you have many doctors to attend to patients, fast, people will get through with their own doctor and go their ways.
Just like Mr. Oni, many other patients are left at the mercy of inadequate doctors to attend to them. According to the Nigeria Medical Association, Nigerians spend over $1 billion yearly on medical care abroad. Leadership of the association had on several occasions decried the spate of migration in the health sector. The chairman, Nigeria Medical Association, Ondo State Chapter, Dr. Adeyemi Oshawe, said poor enumeration of workers is a major trigger for the large exodus.
Yes, many doctors, nurses, and other health workers are leaving Nigeria for other countries. And this is not because this is because they want good lives for themselves. As it is, Nigeria is not that safe because of kidnapping here and there. It has become a trade now for a lot of people, and that's why many of our doctors and nurses are leaving the country. Of remuneration generally, we understand that Nigeria is many of our workers are not getting their salaries as when due in this country, and that's why many of our doctors and nurses and other health workers are leaving the shores of Nigeria.
The physician in charge of the University of Medical Sciences Teaching Hospital, Akure, Dr. Adeshino Akinton, said on several occasions only one doctor will be on call in many of the sub-units of the hospital, leading to overstretched medical staff.
The single most important factor in the healthcare industry is the human resource. You can build gigantic structures. You can bring in equipment, multi-million naira or multi-million dollar worth of equipment. But if you don't have the personnel, all right, that would attend to the patient, who will make use of the equipment, who will who will live inside those buildings to work in order to treat the patients, then you have not wasted your time, So, really, it is a problem that government needs to pay attention to. In fact, I think it's time that the government of Nigeria decided to declare a state of emergency in the healthcare sector of Nigeria, with the way our people are running out of the country.
He said poor working condition has also forced many doctors out of the system, as the few doctors left struggle to attend to the increasing number of patients.
For us, for the state here, it's not just doctors, nurses moving out of Ondo State to the UK, to Canada, to Australia and the likes. People are moving from Ondo State to Osun State to Ekiti State, and that has to do with some factors that are peculiar to our own scenario in Ondo. So we get resignation on a daily basis on our tables, not here alone, but for us in Ondo State, people leave usage, people leave Ife, people leave UBTH, all these other hospitals across Nigeria, people leave. The problem we have today is that we are not getting people. In Unimed, we advertised for doctors and nurses. Nobody came.
That bad?
Oh yes. Even those who came, we get them came. You give them. Some of them will come for the employment letter. Some will not even come. They come for interview. You come at because before there's employment letter, you get somewhere else. Before now, of course, we had a sizable number of doctors and nurses. We could run our unit, our clinics, and do surgeries and their likes. There are departments where you have 3 doctors before, that you have 1 now. There are departments where you have 1 consultant with 3-4 doctors under him. Now that consultant is alone now, or even with 1 doctor. There are departments we don't have middle level doctors again, only consultants. And you see, healthcare is a team thing, right? The consultant now in many of our units here are doing the job of house officer, doing the job of medical officer, the job of resident doctors and consultants. There's no way that person will be efficient. It's not possible. And there's a limit to how much the person can do. If for example you have a clinic where you see 60 patients per day, when you had maybe 2 consultants and 5 medical officers. Today you have 1 consultant, 1 medical officer. Can you see 60 again? You cannot. Unless the person wants to kill himself.
Nurses work intertwined with doctors, but the chairman Nursing Association, Nigerian Nurses and Midwives, Ondo State, Kende Olomiye, says the brain drain is also taking a toll on its members. Nigeria's Nurses Union says 11,000 members have left the country in the first 3 months of 2022 to work in hospitals abroad. Mr. Olomiye revealed that before now, there used to be 20 nurses per shift, but it has reduced to 8 nurses per shift.
The ratio of patient to the nursing officer on duty is now increasing, and the pressure is getting much, and then the productivity invariably will reduce. Why? When we are having per shift we must have 20.
20 nurses
per shift in the ward. Today, most of the wards, if you are blessed, then you will have 8. You know, in that figure 8, you have the administrative aspect of it. At least 2 or 3 people, the OC, the head of that department. So when you remove that remaining 6, if you are removing those remaining 5, that the workload is getting out of hand. The 5 cannot take care of at least the job. Even when it is 20, that's 88 hours, it's still giving us a stress. Not to talk about when it's now falls to 5. That 5, now, until someone may likely sick. Even as today, we are managing most of our colleagues on the terminal illnesses. This is quite unfortunate. We have some hospitals where you merge wards. Female medical, male and nurse will be taking care of the 2 wards per shift. It's cumbersome.
A nurse will be taking care of 2 wards.
That wards per shift. We can't allow the system to close down. We cannot allow the system to close down. We can't allow the system to close down. So people are still working. And even the primary care development agencies they are just like a buffer in the system now. Every place is now, people are opening basic health centers to cushion the effect of the secondary and the deficits in tertiary facilities in the state.
With deficits of health workers at the state hospitals, the Akure annex of the Federal Medical Hospital now has an influx of patients. And according to a consultant family physician at the center, Dr. Elo Oji, the influx of patients on the facility has overstretched the hospital. Dr. Oji said the effect is better experienced than explained.
In Ondo State, we have a peculiar situation because the state hospital is not working. A lot of doctors have left state hospital, and so the load of patients coming to the annex here is high, and so we have a lot of patients come to annex. And then to compound the problem, the insecurity on the road. So a lot of people, they don't even want to go to, because when they think of the insecurity, kidnapping and all of that, herdsmen issues, they don't want to go to FMC. And so you see them, they come, even if they wait till night, they're not bothered because they don't want to face the risk of their life. Poor road accidents, you understand, the roads are not good, and reckless driving and all of that. So because of that, the workload here has really increased, coupled with the fact that the manpower here has not increased and all of that. So to even have junior doctors is difficult. Most of the people working here are senior doctors, and they are made to do jobs that are their designation for them. And also the ASU is on strike. Medical students are not in school right now, and then the junior house officers, we don't have them because there's nobody teaching them. They are not being released. And so it's a backlog of effects on the health sector, and it's really affects services rendered to patients.
Social commentators say while the immediate future is bleak, the government can reverse the trend.
The work that is supposed to be done as a medical doctor by 4 or 5 doctors, only 1 person or 2 persons doing it, is going to bring in a lot of hardship on the people practicing the medicine, and on the size of our people that are receiving the medical care and medical services. You see, it costs them a high level of delay in the hospital. They stay longer than necessary in the hospital environment before they can obtain the services and that they want. And in addition to that, cost of obtaining health services is getting higher, because of the fact that one, cost of drugs, cost of other hospital consumables, and all of these things are getting higher.
I say government should be alive to their responsibility to ensure that people don't migrate from this country to foreign land. Yes, it's good to always go, but you can go for research, go for further studies, come back and expand the knowledge. Then not only the issue of this brain drain, insecurity is what informed the movement on some people. Because we have some who ordinarily would have still want to stay back to salvage the situation, but where they are no longer safe. You can't blame them, or whoever has the means of doing them. So the foreigners are ready. Go to Canada, Canadian government, they are ready to embrace our citizens. Go to Britain, go to US. They are ready to embrace them because they know the impact of Nigerians. Nigerians are very brilliant people, and they are making waves in foreign land.
Notwithstanding the death in the health sector, the state government is also putting in measures to provide accessible and affordable health care to residents. One of those initiatives flagged off by Governor Rotimi Akeredolu is the Orange Health Insurance Scheme for public servants, aiming at making health care affordable to the populace. The governor urged traditional rulers and religious leaders to propagate the scheme among the people.
The Ondo State Health Commission has now taken health insurance compensation a step higher with oranges that we are launching today. In spite of obvious economic constraints across Nigeria, we have approved joint contribution of 3% of gross salary of each public servant under the sharing ratio of 1.8% by the state government and 1.2% by individual public servants. The finance is not won by the civil servants or public officials alone. We share it as a ratio of sharing. As you are paying, the government is paying also for you to benefit. So, individual public servants pay less than what the government will pay. For me, this is a premium family health insurance plan. It covers you, as I mentioned, your spouse, and 4 biological children.
The Commissioner for Health, Banji Ajaka, however, says the issue of brain drain is not peculiar to Ondo State.
Not peculiar to us, Doctor living this country is not peculiar to Ondo State, but we are bringing in. We are going to employ doctors. We are going to bring in more health workers. You know, we are renovating. We are upgrading our facilities. We are doing all manners of things for the state. You know, health insurance scheme to go up.
Is the employment of more medical practitioners the panacea to the menace of brain drain?
Healthcare industry lives on a number of personnel, doctors and nurses. Quality, so we talk about quantity. Number must be okay. If a doctor is taking care of clinic, and that one is doing ward round, and that one is doing surgery, you now have a situation only one person. We do clinic, we run clinic, we move from clinic, you go and do ward round. From ward round, they say, okay, the patient is already in theater, it goes to theater again. It's not a robot now. So the quality will suffer. And of course, when the quality suffers, quality of care suffers, what happens? The outcome is poor. And then needless mortality, needless morbidity. That's the truth.
Nigeria Medical Association said between 2016 and 2018, Nigeria had lost over 9,000 medical practitioners to the United Kingdom and Canada alone. Health capacity is an integral part of Sustainable Development Goals, which aims at ensuring healthy well-being by 2030. An increase in the number of healthcare workers, especially on a ratio basis, means improving the health capacity, which is a panacea for achieving the Sustainable Development Goals 3. However, with the current realities in the health sector, will the provisions of the Sustainable Development Goal 3 as regards health be fully practicable in Nigeria? That's the end of the program. Until next week, bye for now.